Well, 3D printing is changing the medical manufacturing industry and medicine in general. Here to tell us more is Dr. Raj Sinha of Star Orthopaedics. Good to see you.
Hi, Brian. How are you?
I'm well. Welcome back.
Thank you so much.
Yeah. So we're going to talk a bit about some advanced technology. That's probably a good way of putting it. How is 3D printing being applied to medicine nowadays?
Well, 3D printing actually is, revolutionizing a lot of industries from all kinds of manufacturing. In medicine, we're actually finding that we can recreate different tissues, areas of bone, for example, that have been lost from cancer or trauma, and we can actually 3D print the structure back in place to be reimplanted into the patient.
So can you actually 3D print human tissue? Is that what I'm hearing?
Well, we're getting to that.
Okay, because I heard you say bone.
Yeah, so what's happening right now, for example, my own personal experience with 3D printing is in the customized knee replacement. So I was part of that team that designed that custom knee, and initially we came up with the tools and how you put the knee in, and they were all 3D printed. Now the actual devices themselves are being 3D printed. And for people who don't know what 3D printing really does, what you do is you're laying down a layer of atoms at a time in this three-dimensional printer, and there's this vapor of the metal, for example, that's in this box, and it's just being printed down through a laser sintering process. You just do one layer at a time until you build the whole structure. So an artificial knee, for example, takes about 24 to 48 hours to print the whole thing.
Okay.
But now if people are missing bone, we can actually 3D print the structure of what's missing in like a metal piece as a perfect fit, and it gets implanted in one operation. Whereas before it would be 2 or 3 operations to get the sizing right. You'd have to do a CAT scan, you'd have to get the size, and then you'd have to trial it out a few times. Now you can do it all in one step.
This is fascinating.
So
it truly is.
It's pretty interesting stuff. Where things are going, I think, and what people are talking about now is, can we actually take the cells of different tissues, use some of the older printers, older inkjet printers that allowed for large particles, and you can actually print the cells onto a matrix. So the matrix is your paper. Think about it in a printer, and now you print the cells onto the matrix into the structure that you want it to be. And then that becomes the beginning of a tissue that can be transplanted into a patient. It's very early technology.
But it's fascinating. Just hearing you say it out loud, I feel like I'm watching a sci-fi movie.
It really feels like that.
Right, but it's not. This is real.
It's like we're creating cyborgs. So people are actually doing this right now in laboratories. Whether how long it's going to take to get to the clinic and to actually putting them in patients is hard to tell. There's a lot of steps to get there. But the fact that we can do it is pretty exciting.
What are some other future applications that you might see?
Well, I think as telemedicine and everything like that starts to progress, I think we're going to be able to see remote delivery of care. So, for example, I might see a patient in Africa who needs something to be done. I see them remotely via telemedicine, and they need X, Y, or Z treatment, and we can print it on site there, so that it doesn't have to be manufactured somewhere else and then transported. It's just printed on site, because technologically, it's just a matter of sending the information over the internet.
Fascinating. Just layering atoms. So what personal experience do you have with 3D printing in general? I know you gave us some idea.
Yeah, so basically my experience with it in medicine is in total knee replacement.
Gotcha.
And it's been pretty amazing, because now, it used to be that if you wanted to custom manufacture something for a patient, it could take 3 to 6 months. Well, now we can shorten that timeline to, as I said, the actual manufacturing process is only about 48 hours.
Jeez.
So you basically take the technology, you take the information from a CAT scan, and then you convert it into digital data, which is then used to program the 3D printer to make the device that's specific to the patient.
All right, Doc, I really appreciate that. If you have any orthopedic issues or questions, this is the place you want to go. Dr. Sinha's office is located in Rancho Mirage. You can check out Star Orthopaedics' website at palmsprings.com. Very easy. Or give them a call. Again, big thanks to you.
Thank you.
Of course, and we thank you. We'll see you after the break, everyone.